All right, so today we're diving into something pretty tricky. Treatment-resistant Graves' Orbitopathy, or AGO for short. And we've got a whole bunch of studies here that point to a really interesting connection between managing cholesterol and this pretty tough condition, maybe some new avenues for treatment, especially for those really stubborn cases.
Yeah, exactly. And for those of you listening who are already familiar with AGO, you know it's an autoimmune condition often tied to thyroid issues where you get this intense inflammation behind the eyes. And one of the main culprits here, and Wei and his team really laid this out in their 2023 paper, is a substance called hyaluronan.
Hyaluronan, right.
Think of it like a sponge. When there's too much of it, it soaks up all this water,
Yeah.
and that causes the muscles and the fat tissue in the eye socket to swell up. You know, that classic IGO look.
Right, the bulging eyes.
Yeah.
So in this deep dive, we're going to try and pull out the most important information from these studies to understand how managing fats in the body, what we call lipid metabolism, plays into this whole inflammatory process.
And of course, what potential treatments we might have on the horizon, especially for those patients where the usual approaches just aren't doing the trick.
Exactly. We know this stuff can get pretty complicated, but we're going to break it all down for you. Thoroughly, but hopefully, in a way that makes sense and maybe even reveals some surprising things along the way.
Absolutely.
Okay, so let's start with statins.
Ah, statins, yeah. Good place to start. There's this 2024 study by Shu and his colleagues. They looked at a large group of hospital patients, and they found that people taking statins, well, they had an 80% lower risk of developing Shugo in the first place. A pretty remarkable finding.
80%, that's huge.
Yeah, it is. And here's the thing, what makes this even more interesting is this protective effect. It didn't seem to matter if the person had high cholesterol or not.
So it's suggesting that maybe statins are doing something else, something beyond just lowering lipids that helps prevent Shugo.
Exactly, yeah. It's not just about the cholesterol levels themselves. And Wei's 2023 review of the field also mentioned a couple of other studies, one by Stein and another by Nilsson from a few years back, that also support this link between statins and a reduced risk of GUGO.
So we're seeing a pretty consistent pattern here across different studies.
Absolutely. We are. And on top of that, Wei's paper also highlighted the findings from the SAGO phase 2 trial.
Right, the STEGO trial.
This one looked at patients who already had GUGO and were being treated with what we call IVGCs. That stands for intravenous glucocorticoids.
The standard anti-inflammatory treatment.
Yeah, exactly. A pretty common approach. And what they found in the STAGO trial was that adding atorvastatin, a pretty common statin, actually improved how well those patients responded to the IVGCs.
Interesting. So it's not just about preventing GUGO in the first place. It's also potentially about making the current treatments for active GUGO work better.
Right, a sort of two-pronged benefit.
And as both Wei's group and Maliguca and their colleagues pointed out in their 2022 review, statins, well, they've got these interesting pleiotropic effects. It's like they're a Swiss Army knife with all these different tools.
Pleiotropic effects, yeah.
They can be anti-inflammatory, they can regulate the immune system, and they even have some anti-scarring properties. All pretty relevant when we talk about GRAGO, where inflammation and tissue changes are, well, they're kind of the big problems.
Yeah, exactly. These additional effects of statins, they could be messing with those very early stages of inflammation that lead to that overproduction of hyaluronan in the orbital fibroblasts.
The cells behind the eye.
Right. Those are the ones. Now, let's shift gears a little bit and see what these studies tell us about the direct levels of lipids in the body and how those might be tied to how GRGO plays out.
Sounds good. This brings us to a study from 2024 by Lamoli and his team. They looked at people who had what they called active moderate to severe GIAO, meaning they were really feeling the effects of the condition and who were being treated with IVGCs. And they found that patients who had higher levels of total cholesterol and LDL-C,
You know, what people often call the bad cholesterol.
right, the bad cholesterol, they found those patients showed significantly less improvement with the IVGC treatment.
And not just in the short term either. They saw this lack of improvement at 6 weeks, 12 weeks, even 24 weeks after starting treatment.
Wow, so it wasn't just a temporary thing.
Nope. So this really adds another piece to the puzzle. If having higher cholesterol is actually linked to not responding as well to a standard anti-inflammatory treatment like IVGCs, then it seems like lipid metabolism isn't just passively hanging around and go. It might be actively involved in how the disease progresses and how well people respond to what we're trying to do to treat it. Makes you wonder, could managing these lipid levels actually be a key part of getting better outcomes for some patients?
It's certainly something to think about. So let's talk about PCSK9. Molly Kuoka and his colleagues, In their 2022 review, they gave a good explanation of this. For those who might not know, PCSK9 is this protein made mostly in the liver that basically tells the liver to get rid of some of its LDL receptors. You can think of those receptors like docking stations on the liver cells that grab LDL cholesterol from the blood.
Right, so more PCSK9 means fewer docking stations, and that means more LDL cholesterol just stays circulating in the blood. It's a pretty important regulator of cholesterol levels.
And then there are PCSK9 inhibitors, drugs like alirocumab and evolocumab. They're designed to block PCSK9 from doing its thing.
Yeah, so you get more of those LDL receptors staying active, which helps the liver pull more of that LDL cholesterol out of the blood. We've seen some really good results with these drugs in terms of lowering LDL-C and reducing the risk of, well, of heart problems.
Heart attacks, strokes, that sort of thing. Now, there's a 2024 study by Huang and his colleagues that adds a bit of an interesting, although maybe indirect, piece to all of this. They used a technique called Mendelian randomization. It's pretty clever, actually. It uses naturally occurring genetic variations to try and figure out if there is a cause and effect relationship between things. In this case, they were looking at targets of lipid-lowering drugs and thyroid disease.
Interesting approach.
Their study wasn't directly focused on JIGO treatment response, but they didn't find a significant genetic link between inhibiting PCSK9 and the risk of developing hyperthyroidism. And as you know, hyperthyroidism is often linked to DO.
Right, that's a really good point. As we're thinking about tweaking lipid levels as part of managing GO, we have to consider any potential effects on the thyroid itself.
Because the thyroid and JIGO are so closely connected.
Exactly. But this study by Huang's team suggests that targeting PCSK9 specifically to lower cholesterol might not actually increase the risk of hyperthyroidism. At least that's what their findings suggest.
Okay, so we've got a few pieces of the puzzle here. It seems like statins might offer some protection against getting GIGO in the first place. And they might even make those standard treatments work better. Higher cholesterol seems to be linked to poorer treatment outcomes. And PCSK9, well, it's a key player in regulating cholesterol, and inhibiting it doesn't seem to directly increase the risk of hyperthyroidism. But how do we tie all this back to that original question, the overproduction of hyaluronan in the orbital fibroblasts that's driving GIGO?
Yeah, that's where things get really interesting. And it's also where the evidence from these particular studies gets a little bit less clear-cut. None of these studies specifically pinpoint a combination of cholesterol-lowering agents that will for sure inhibit hyaluronan synthesis in orbital fibroblasts.
Right, there's no magic formula yet.
But we're starting to see some pretty compelling hints, some indirect connections that are emerging.
So statins have those anti-inflammatory properties. And then Lamoli's study showed that higher cholesterol seems to be linked with a worse response to IVGCs and GIO. Put those together, and you can imagine a scenario where using statins to reduce the overall inflammation might actually be indirectly influencing those signals that tell the orbital fibroblasts to make too much hyaluronan.
Right, it's like calming down the whole system might help calm down those specific cells behind the eyes.
Exactly. And there's an older study from 2009 by Zhang and his colleagues. It was cited by Li Zhang in a 2020 paper, and they found that activating the thyrotropin receptor, which is a key receptor involved in thyroid function, actually increases hyaluronan production in those pre-adipocyte fibroblasts. Those are like precursor cells in the orbital tissue, and they play an important role in how LDO develops.
Oh, interesting.
So maybe statins could be affecting the signaling pathways of this TSH receptor somehow.
Or the inflammatory processes that happen downstream. Yeah, that could be another way that they might indirectly be affecting hyaluronan synthesis.
It's like a chain reaction. Statins might help reduce the overall level of inflammation, which then calms down those signals, telling those cells to churn out all that hyaluronan that causes the swelling. But what about those cases where those standard treatments like IVGCs just aren't working?
Right, treatment-resistant GO.
Our sources touch on that a bit too.
Yeah, the 2022 consensus statement by Birch and his colleagues, that gives some really good guidance for those situations. They say that for patients who have active, moderate to severe TED, which is another term for Graves' eye disease, who aren't responding well to glucocorticoids, well, there are other therapies that doctors might consider, like rituximab and tocilizumab. These are drugs that might help inactivate the disease process. They also point to teprotumumab as a good option for cases where there's significant bulging of the eyes or double vision.
So these are kind of the next level treatments, the ones that clinicians might use when the initial more standard approaches aren't doing enough. And Lamoli's findings about high cholesterol potentially making those initial IVGC treatments less effective, well, It really highlights why we need these other strategies for some patients.
Yeah, if someone's lipid profile is interfering with those standard anti-inflammatory treatments, then we need other tools in the toolbox.
Exactly. And Birch and his co-authors also make a really important point. They say that if a patient isn't responding well to intravenous methylprednisolone, which is a specific type of IVGC, after about 6 weeks of treatment, then doctors should think about stopping that treatment and trying one of these alternative therapies. They also mentioned that doctors should try to avoid giving a total dose of IVMP that's more than 8.0 grams.
Right, which really shows the limitations of just cranking up the steroid dose.
You can't just keep increasing the dose indefinitely. There's a balance between controlling the inflammation and managing the risks of long-term high-dose steroid use. Which brings us back to needing those alternative or additional therapies and how managing lipid metabolism might play a role there.
Absolutely. Now, let's look at some other things that came up in these studies. There's this 2023 study by Park and his team where they found that in their group of patients with TED, high levels of TSI, that stands for thyroid-stimulating immunoglobulin, it's an antibody that's often elevated in Graves' disease.
Right, TSI.
They found that high levels of TSI, along with lower levels of LDL cholesterol, seem to actually predict a better response to steroid treatment, which might seem a little bit contradictory to what Lamoli found.
Yes, like, wait a minute, which is it?
Right. But it's a good reminder that GROW is complex, and it can be a bit variable from person to person. What might be true for one group of patients might not be true for another.
It's not a one-size-fits-all disease.
Exactly. And in Park's study, it might be that those lower LDL levels were kind of a marker of a more favorable overall inflammatory profile, a profile that was more likely to respond well to steroids, especially when you consider those high TSI levels, which are kind of a hallmark of Graves' disease.
So it's not just about individual factors, it's about how they all interact.
Right, the whole picture. And then there's this 2021 study by Kilada and his colleagues that adds another layer of complexity. They found that having other autoimmune conditions could actually influence how severe and active someone's TED is.
Interesting.
Specifically, they found that people who had other autoimmune diseases but weren't taking immunosuppressant drugs tended to have higher clinical activity scores when their TED first showed up, meaning their TED was more active.
So having other autoimmune issues could make MIRGO worse.
It seems like it could. It suggests that the overall activity of the immune system, and not just what's happening with the thyroid and the eyes, can affect how Grego developed.
It's all connected.
And then Diamante Kandarakis and his colleagues, in a 2019 review, they remind us that it's always important to think about the possibility of drugs causing endocrine problems, including thyroid issues.
Right, so a good medication history is always important.
Absolutely. They even mention that statins themselves can sometimes cause muscle and joint problems, although a 2024 study by Diamori and his colleagues suggested that statins don't seem to make symptoms specifically worse in people with fibromyalgia.
So with Tego, it's not just about treating the eyes, it's about understanding the whole patient.
Absolutely. And as Kambaj and his colleagues pointed out in their 2023 review, there's a lot of research happening right now into new and more targeted treatments for TED, like drugs that target the IGF-1 receptor. These aren't directly related to cholesterol lowering, but they're part of this push to find better therapies for Bego, especially for those folks who don't respond to the more standard approaches.
So the research is moving forward, which is good news. Okay, so if we try to sum up all of this, what are the key takeaways from this deep dive? What do we really need to remember?
I think a few things really stand out. First, there's more and more evidence that statins might help prevent DOGO from developing, and this might be due to something beyond just their ability to lower cholesterol. It could be related to their anti-inflammatory or immune-regulating effects.
Right. Statins might be more than just cholesterol-lowering drugs.
Exactly. Second, research, especially that study by Lamoli and his team, suggests that higher levels of total cholesterol and LDL-C, that bad cholesterol, seem to be linked with a poorer response to that standard IVGC treatment for folks with active, moderate to severe GO.
So managing cholesterol might actually help those standard treatments work better.
That's what it looks like. Now, these sources don't give us a clear answer about the absolute best combination of cholesterol-lowering agents to directly stop hyaluronan production in those orbital fibroblasts, but we are seeing more and more clearly how lipid metabolism, inflammation, and treatment response are all intertwined in DOGO.
Right, they all influence each other.
The fact that statins have anti-inflammatory effects and that high cholesterol seems to be linked to less treatment success, well, It suggests that changing lipid pathways could affect those inflammatory processes that drive the overproduction of hyaluronan.
Like a domino effect.
Yeah, and that's where more research is needed to really nail down those exact mechanisms and to figure out the most effective treatment strategies, especially for those patients with treatment-resistant JOGO. That future research could explore using statins or other drugs that affect lipids, maybe even combining them with some of these newer therapies that are being developed, all with the goal of achieving better, longer-lasting results for patients.
So we're left with this really interesting idea. Could we be heading towards a future where directly targeting those lipid pathways within those orbital fibroblasts becomes a key part of managing and even preventing severe JOGO, particularly for those cases that don't respond well to what we can do now?
Yeah, and what other effects of lipid-lowering agents might we discover that could help in this context?
It's definitely a fascinating area with a lot of potential for breakthroughs.
Yeah.
Absolutely. And for those of you listening who want to really dig into all the details of this research, I definitely encourage you to check out the studies that we've been talking about. They're full of great information, and they show just how dedicated researchers are to understanding and finding better ways to treat this condition.
Thanks for joining us for this deep dive. We'll be back soon with another exploration of the latest in medical research.
Until next time.